नमस्कार. लाईफ्स ऑन विथ मणिपाल हॉस्पिटल्स या कार्यक्रमात तुमकां सगळ्यांक परत एकदा येवकार. मनशाक सदांच एक भंय आसता. सादारण 40 वर्सां जाली की ताका मरणाचो भंय दिसूंक लागता. आनी मरणाचो भंय हो 2 कारणां खातीर दिसता. एक हार्ट अटॅक आनी दुसरो कॅन्सर. बाकीची ताका कसलीय दुयेंसां जाली जाल्यार ताका भंय दिसना. पूण हार्ट अटॅक केन्ना येत आनी आपल्याक कितें जायत म्हणून एक फाटल्यान खंय तरी ताका भंय दिसत आसता. एंड टुडे वी हॅव विथ अस ए पर्सन who has joined Manipal hospitals, Dr. Sabyasachi Mukhopadhyay, who is an interventional cardiologist. Now, what is cardiology? What is cardiothoracic surgery? And what is interventional cardiology? They are 3 different terms which mean 3 different things to patients, and they take place in 3 different types of patients. So first we welcome Dr. Mukhopadhyay.
Namaskar.
Nice to meet you. Now basically I would like to ask you that dreaded question which everyone has in mind.
Yes.
What is an heart attack?
Okay, heart attack is basically a demand supply mismatch of oxygen and other nutrients in the heart. Now this can occur in various ways. The most common way is in which there is a clot which lodges in one of the 3 arteries that are there in the heart, which supply only the heart. So what happens in that is the oxygen and other supply of other nutrients is immediately stopped, and the muscle starts to die immediately, starting from the very first minute itself. And as soon as this is detected or observed, or the symptoms are observed, there are various symptoms. Like there may be chest pain, there may be palpitation, that is a fast, real feeling of your heartbeat. There may be some sort of tiredness, and there may be breathlessness, means you're feeling out of breath. So if any of these symptoms are occurring, in fact there are some other symptoms also, like the patient may present with vomiting. Yeah, patient may present with vomiting, sweating, and at times we have even seen patients with loose motion who have actually been later detected to have heart attack. So any symptom that you have, you should immediately report to a doctor, and preferably a good, well-equipped hospital which has all the cardiac facilities, and get an ECG done. Because that may be the most life-saving thing that you can do. And of course, we evaluate in other ways also. And another thing that I should tell you is that 25%, almost 1/4 of all heart attacks are silent. So it is always wise to come to the hospital at any point of time when you are feeling anything vague. And another thing that I should caution you is that Indians are more prone to heart attack. 60% of all heart disease cases occur in Indians, wherever they are in the world. We have 13% of the world population and 60% of the heart disease. So you can imagine there's such a lot of imbalance in the proportion. And this is due to a combination of various factors. Firstly, we are genetically more prone to heart disease. Somehow...
As a race, huh?
As a race, yes. Indians, not just Indians, South Asians, means that includes Bangladeshis, Nepalis, and Pakistanis also. So as a race, these South Asians, they are more prone to heart attack. And second factor that is most important is there is a lot of rampant diabetes, which is a cause of concern. There is a lot of hypertension, that is high blood pressure. There is a lot of high cholesterol. And there is a lot of dietary abnormalities that we have. We have shifted as a race of having normal food at home, cooked at home, to food which we are having from outside.
Yeah.
And outside food, you cannot be sure of 2 things. One is the cooking medium, and second is the ingredients that they are using. Stress and adulterated food are one of the most common causes of causing direct heart disease, as well as causing blood pressure, diabetes, cholesterol, other problems.
So doctor, if you have diabetes, if you have cholesterol, if you have hypertension, you are more prone to get heart attack.
Yes, each of these risk factors causes a twofold to threefold increase in heart attack.
I see.
So, and another thing that we are cursed with, I would say, Indians are cursed with, or South Asians in general, is that we are getting heart attack at a lower age. 10 years earlier than our European counterparts. 10 years earlier. And that is a cause for concern, because most of us are in that age group where we have to earn a living. So there is a loss of man hours in that respect, and this is again a loss, a great loss for the country.
Doctor, symptoms that you said, see, you have loose motions, or
Yeah.
you have some different feeling altogether. Now, most of the times you have a chest pain, you correlate it with.
Yeah, these are some of the other unusual symptoms which I talked about. So that any symptom that you get, cough, breathlessness, anything, in fact, it is possible even to get a fever in heart attack. Yes. So any symptom that you get, because we are more prone to heart disease, it is always wise to check the heart and see if any, the heart is involved in anything.
How often would you recommend anybody above the age of 40, say?
I would recommend 35.
35, huh?
Yes, 35.
To get the ECG done.
And not ECG done, a general checkup which includes lipid profile, that is checking for cholesterol, creatinine, that is checking for the kidney disease. Also, I would recommend echo and TMT. So all these tests, they would actually tell us that whether there is any possibility. Another important thing is that family history. Family history. A lot of us have some family in the first degree relatives. That includes our brothers, sisters, or our mother, father. So if anybody has got history of heart disease, it makes us more prone to having heart disease.
Now, say some patient has got these symptoms and he goes to the doctor. And like you, he has a very famous interventional cardiologist there. Now, what is the, say step by step, how this patient is treated?
Yes, first we see the vital status, means whether the patient is, conscious, oriented, what is his pulse, BP, and, whether he is able to lie flat or not. Then we check the ECG, then we check the blood for any cardiac enzymes, rise in cardiac enzymes. That tells us, but of course that occurs 6 to 8 hours later, but that tells us whether there is any cardiac damage or not, muscle damage in the heart or not. So those tests have to be done, then the X-ray, echo. So all these tests are done immediately, and if there is any suspicion, then we immediately admit and start treating. And the best treatment for a heart attack is angioplasty, doing a coronary angiography, seeing where the blockage is, and then removing the blockage and putting in a stent out there. That is the best treatment all over the world. And it is generally 90 to 95% successful and efficacious.
Now, there is a common question which everybody has in mind. Like blood test is done as routine, ECG can be done as routine, X-ray can be done as routine. I can walk in and say, please take my X-ray of chest. Can angiography be done as routine?
No, it is not recommended as a screening test because there are a lot of things, parameters involved. Firstly, the patient needs to be admitted. Secondly, it is an invasive test. And thirdly, the cost-benefit analysis does not add up to being a very viable test in case the patient does not have any other symptoms or evidence of any heart damage.
Oh, so it is not advisable to just ask for it.
It is not advisable as a screening test. It is not advisable.
It should be done only on the advice of the doctor.
Yes, if we feel that, yes, there are 3 or 4 risk factors or something is positive in the sense that even if a patient doesn't have a heart attack, if a patient has some stress test which is come out as positive, either the treadmill test or the dobutamine stress test, or the thallium, stress thallium, which has come as positive, then we definitely recommend. If the patient already has ongoing chest pain without ECG changes also, even then we recommend a angiography.
But it is under recommendation.
Under recommendation. It is not like a walk-in test. You cannot go and order a angiography and have it done.
Doctor, another question that comes to my mind very often is heart attack can occur anywhere.
Yes.
Yeah. Like you have first aid for other organs of the body, especially the bones. Do you have a first aid which can be given, which can be taught to the people?
Yes, there is, but without diagnosing a heart attack, giving that is slightly risky, because there are a group of tablets, 3 tablets, which we also give in our emergency department when a patient comes and we diagnose him with heart attack. First of them is an aspirin, second is a tablet known as clopidogrel, and third one is a tablet known as atorvastatin. These tablets that we give can be kept at certain medical centers or emergency centers or first aid centers where they can be given, but provided you have seen the ECG and you have seen that there is some ECG abnormality which correlates with some ischemia or some ongoing chest problem, heart problem. So without that, giving an aspirin, especially a lot of people have a lot of acidity, some people have undiagnosed ulcers also in the stomach. Giving an aspirin is slightly dangerous in such people.
And doctor, now sometimes you have cardiac arrest. Yes. Now, what is cardiac arrest and what is cardiac attack?
Cardiac arrest is a stoppage of all heart functions. Now, this happens sometimes in some patients. It can happen without a heart attack also in heart failure patients. Now, what we do immediately is we call for help. Supposing the patient is outside the hospital environment, we call for help. Immediately you should call for help, and then you should start pumping. Pumping means you have to give chest compressions at the rate of around 90 to 100 per minute.
Oh.
And the chest compression should be over the middle bone, which we know as the manubrium sterni, the sternum. So we have to give it over the sternum, and we have to give it to around 5 centimeters, that is 2 inches depth, and it should be given 90 to 100 per minute, and after every 30 such compressions, you have to give 2 breaths. It is better if you have somebody with you who can help. And another thing that is, I think, very helpful, and in some places it is, I think, mandatory. We have all seen in airports these AEDs. So these automated external defibrillators. So what they do is, once you attach those 2 pads, it will diagnose the rhythm for you. And supposing that rhythm is a rhythm which can be shocked, then it will give the shock, and then the heart, what we do is, with a shock, we stop the heart, and the heart recovers on its own and it starts beating on its own. If it doesn't, then you start giving the cardiac massage again, that CPR again.
Till the patient gets the medical attention.
Yes, till the patient gets proper medical attention. But all this that I am talking about is outside the hospital environment. Inside the hospital environment, we know everybody gathers together within 30 seconds and we know the drill. We go according to the drill. We give some injections also at the same time. Some adrenaline, some atropine, all those injections are given. We sometimes intubate also.
And doctor, coming back to angioplasty, there are sometimes multiple blocks, like the reports say. Now, when a interventional cardiologist will refer or decide that the person requires a cardiac surgery, bypass, does it depend on the number of the blocks?
Yes, it depends on the number of the blocks and also the location of the blocks. Supposing it is a block which involves the left main artery, what we call as the left main artery. Left main artery is an artery which divides into 2 arteries, the left anterior descending and the left circumflex. So in case it involves the left main artery, then generally the results are better with a bypass surgery rather than angioplasty with stenting. Otherwise, we do not stent below 50% blockage. Below 50% we do not stent anywhere. Above 70% we see, if it's a very small caliber artery, then again we do not stent. We just keep the
on medical.
On medical management, or sometimes we may just balloon it and leave it. If it is more than 70% and it is a good caliber vessel, and generally if there are less than 3 blockages, then angioplasty has a good outcome. If there are more than 3 blockages, if you have to put more than 4 or 5 stents, I think it would be a better idea to go in for a bypass. Of course, if it involves only one vessel, it is better that angioplasty is done. And if it is involving all 3 vessels and the left main, bypass is definitely a better option, definitely.
And after stenting is done, what is the hospital period? You have to stay in the hospital, number 1. And number 2, after stenting is done, what are the precautions that the patient has to take?
Yes. After stenting, we generally keep the patient for 3 to 4 days.
That's all?
Yeah, that's all. And generally, because we do it through the wrist, so the patient is mobile. Apart from the wrist movement, nothing else is restricted. And if a patient has had a heart attack for which he has been stented, then we say that 1 month's rest in the sense not exactly bed rest, but he can move around in the house, but no driving and other strenuous activities or going to office is allowed. After 1 month, everything is allowed, but of course in a graded manner. We say that you step up your physical activities, mainly walking, cycling and swimming. These are the 3 recommended activities. Any one of them you can choose. Another thing that we normally say is that please do not do any weight training or go to the gym. So this is not a very good idea. And another thing that of late, I think you have also seen in the news and we have also heard, is that a lot of people are doing a lot of strenuous and physical activity, especially running the marathon and doing a lot of other activities which are not recommended as such unless you are a professional athlete. Especially weight training. We have seen a lot of, in fact, one of, my school friends, he collapsed in the gym. So, and we have also heard lately a lot of people have collapsed in the gym. And I would not recommend, because I'll tell you the reason why this happens. Why this happens is that once you are doing weights, you're lifting weights, then the afterload, that is the blood pressure just above the heart, where there is a vessel known as aorta. The central aortic BP rises up. So the heart has to pump against a higher pressure. So in case there is a very delicate balance which has not been detected earlier, the heart may collapse at that time.
Doctor, now you have done something extraordinary in Goa very recently. Can you just in short tell us what is that?
Yes, what we have done recently is we have put in a combo device that is also known as a CRTD. Now what this device does is it does 3 things. Firstly, it acts like a normal pacemaker, which means that it gives a backup of providing a heart rate so that the heart keeps pumping. And secondly, what it does is it detects arrhythmias. Arrhythmias means rhythm disturbances of the heart. And in case there are any dangerous arrhythmias, it terminates them with a shock. And the quantum of shock is very less. It is like compared to an outside shock that we give to treat the patient when a patient has cardiac arrest. This shock is only 18 joules, whereas that is around 200 joules, 150 to 200 joules. So the patient might feel a little uncomfortable, but then it has been treated. So immediately that dangerous rhythm has been terminated and the patient comes back to his normal rhythm. And he already has a backup pacemaker. So the third function is it improves the pumping of the heart. It improves the pumping. How it does it is it's a process known as synchronization. What it does is there are three leads in the heart. So on both sides of the main pumping chamber, there is a lead. The main pumping chamber is the left ventricle. There is one lead on both sides of the left ventricle. Now it synchronizes the muscle action and the contraction on both sides of the left ventricle at the same time. So in effect, it causes more effective contraction, and what we commonly know as the ejection fraction, it improves significantly.
Now this has come as a substitute for your stents now?
No. This is not a substitute for stents. I'll tell you the profile of this patient that we did in this recently, this procedure. He was a patient who was working in Saudi. 2 years back, he had a heart attack. He was stented out there. But because probably he went late or the procedure could not be done in time, the heart muscle never recovered. Heart muscle never recovered. He came back to India. Last year, he had another problem, which is known as subdural hematoma, which means there was bleeding just inside the brain. And we stopped some of his anti-platelet drugs, the blood thinners, and we switched him over to another anti-platelet drugs. Then, of course, all throughout this period, his heart pumping remained low. It remained at around 30 to 35%. Of late, he was getting some spells of giddiness and syncope. So we thought that this is the correct time. Because it is an expensive proposition, it is not easy for a doctor to even suggest such a procedure, because it involves a lot of money, and not all of us are covered by insurance. So this patient already had a heart attack and was stented earlier, and in spite of that, his heart function never recovered. So this was to help him threefold. One, to act as a pacemaker. Second, to terminate his dangerous arrhythmias. Third is to improve his pumping. Now it's been almost a month now, and he's been doing quite well.
Good. And the last question now, very common question and common problem, especially in Goa. Tobacco we know is harmful.
Yes.
And smoking, surprisingly, it has decreased much because of work of anti-cancer people. What about alcohol? Because people are under impression that 30 ml of alcohol dissolves the plaque.
I'll answer this question. Yes, like you rightly said, tobacco actually hasn't reduced much in the population. It is just that in Goa, the tobacco abuse is less.
Oh.
In Goa, I've stayed all over the country, and I've seen elsewhere the tobacco abuse is really in very high proportions. Okay, so coming to that second thing, alcohol. Now, alcohol, what they say is that it does not per se cause blockages. What it does is two other harmful effects it causes. Second is the first harmful effect is it decreases the pumping. It is basically a myotoxic, means it is harmful for all muscles all over the body. So it is myotoxic. Now, heart is entirely made up of muscle. So it is cardiomyotoxic. So that means the pumping efficacy will be reduced by alcohol. Second effect is again that same thing that I was talking about, is the central aortic BP goes up. So in effect you have a heart which pumps less and against a higher pressure. So even though it does not cause blockages per se, you could say that is one step forward.
Correct.
But these two negative effects means you are 2 steps backward.
Yeah.
So having alcohol means that you are going 1 step backward.
Oh, nice. म्हाका दिसता कितलीशीच माहिती आमकां मेळ्ळी. म्हणजे आमचें घरचें जेवण जेवपाक परत आमी सुरवात करूंक जाय. भायल्या जेवणान कितें आसता आनी तें कशें केल्लें आसता हें आमी नकळो आसता. हांगच्यान हार्टाचेर आमी प्रेशर घालपाक सुरवात करतात. तकली शांत दवरूंक जाय. तापातापी चड करूंक जायना. खंयचीय गजाल प्रत्येकाच्या आयुश्यान बरे दीस येतात तशे वायट दीस येतात. वायट दीस येतकीच तापातापी चड जाता, ताजेंय प्रेशर वाडटा. टॉबॅको आनी आल्कोहॉल हे तर सामके विखारी. कितेंय निमित्ता सांगतात खंयच्याय हाका ना अशें घेतल्यार कांय जायना, तशें केल्यार कांय जायना, हें सगळें फट. तें जावपाचें आसा तें जाताच आनी जातकीच भिवोवपाची आतां गरज ना. कित्याक आमकां एन्जिओप्लास्टी आसा, बायपास आसा आनी आतां दोतोरान सांगलें तशें पेसमेकरा सारकें एक इक्विपमेंट भितर घालून हार्ट रेगुलेट करूंक मेळटा. म्हारगाय आसतलीच पूण जाल्यार आपल्याक सारको जगूंक जाय जाल्यार पयलीं हार्ट एटॅक येना तें पळोवंक जाय. आनी आयल्यार डॉक्टर मुखोपाध्याया सारके दोतोर उपलब्ध आसा, तांचो फायदो आमी सगळ्यांनी करून घेवंक जाय अशें म्हाका दिसता. Doctor, thank you so much for enlightening us on this very topic which is very close to the heart.
Yes.
Thanks so much.
Thank you for giving me this opportunity. Thank you.